Mr. Speaker, it's an honour today to stand up and join the discussion as my honourable friend from Kitchener-Conestoga has appropriately called this parliamentary show of unity on Bill C-300, the Federal Framework for Suicide Prevention Act. Mr. Speaker, I apologize, Mr. Speaker. Having just celebrated Mother's Day, a day when we all recognize the unfailing love, support and guidance of mothers, and thinking about this discussion today, I can't help but imagine the sheer anguish that a mother who lost her daughter or her son to suicide this past year must feel on Mother's Day. It's utterly heart-wrenching to think about it. Over 4,000 families, mothers, fathers, sisters, brothers, aunts, uncles, and cousins had their lives irreversibly impacted by suicide in this past year. And we don't even have a good handle on a true number, something that this bill will fix, Mr. Speaker. I had the privilege of rising in this House 19 days ago on April 25th to make a member statement in support of this bill. In the 19 days since then, there have likely been 190 deaths by suicide, 19,000 suicide attempts, and 4,180 visits to the emergency rooms of hospitals across the country due to suicide behaviours. Mr. Speaker, I say likely because we don't have accurate suicide statistics in this country, and once again, this is something very important that Bill C-300 will correct. However, the real tragedy is the story behind each one of these numbers. It's a tragedy because each one of those who attempted suicide had lost hope. As a member from Kitchener-Conestoga has already said, the fuel of the human spirit. And in doing so, their tragedy was and is compounded on their families, friends, and the communities of our nation. Mr. Speaker, we know that suicide is a very complex confluence of a number of factors. We know that some groups and circumstances are more vulnerable to the threat of suicide than the general population. Veterans and Aboriginal Canadians have been noted already here this morning. But we struggle to develop a suitable evidence-based response. Mr. Speaker, there's no doubt this is a public health issue in Canada. We have a duty in defence of the sanctity of life to act. According to the testimony that Dr. David Goldbloom of the Mental Health Commission of Canada presented to the Health Committee, over 90% of the Canadians who die from suicide are experiencing some sort of mental health issue. By the very nature of the complexity of the problem of suicide, approaching suicide prevention is complex in and of itself. Teachers in a position to recognize suicidal behaviours are rarely trained to do so. It's even uncommon for medical doctors and nurses to receive specific training in this area. That's where this bill helps. There are many suicide prevention groups in Canada doing outstanding work. They are on the front lines. They are there when people need them. They help refuel that hope. Even if it's for a short period of time, it gives them another chance. That's why setting up a federal framework to better coordinate these efforts makes so much sense. Great work is being done by so many groups from coast to coast. Mr. Speaker, I mentioned one such group 19 days ago in this chamber called the Jack Project. This initiative was spawned by the tragic death by suicide of young Jack Windler. The project's school-based outreach program is now being piloted for a full rollout next year, and I know all of my colleagues would wish them all great success. Let's leverage and share information and resources, share successes, and ensure we can share accurate statistics as well. That's national leadership, Mr. Speaker, and it's a message of hope to vulnerable Canadians. Mr. Speaker, let me reflect on two of the statements made to the Health Committee on this bill, which will sum it up well. One was Dr. David Goldbloom, who I referenced a couple of minutes ago. He was speaking on behalf of the Mental Health Commission of Canada, and he said, "The federal framework that's under consideration today will definitely advance the strategy's recommendations to mobilize leadership, to strengthen collaboration, and to strengthen the infrastructure that's required to improve mental health outcomes in Canada, with a particular focus on suicide prevention." Mr. Speaker, this view from a medical professional speaks volumes. And so does the other statement I wanted to highlight, a view from the very front lines of suicide prevention. Tana Nash from the Waterloo Region Suicide Prevention Council in a community just a few minutes up the highway from my constituency, remarked on how the federal framework could be the catalyst for a hub of resources, evidence-based information, and programs which would be a godsend for organizations that are cash-strapped yet are doing so much in local communities. Here's what she had to say. I can tell you from grassroots organization that this is essential. We are all operating on shoestrings and non-existent budgets. But we imagine a hub where all of us working across Canada can access tools, brochures, and ideas where we can simply add our own local crisis information instead of reinventing the wheel over and over again. But, Mr. Speaker, what is most encouraging is the example she gave of how a groundbreaking program run by her organization was unknown in my community of Hamilton. An excellent program taking place at the grassroots level to help prevent suicides in the most practical, direct way possible, and how the federal framework proposed by this bill could help make that connection and save lives. Listen to these words from Tana Nash of the Waterloo Region Suicide Prevention Council. One example from the Waterloo region is the Skills for Safer Living group. This is a 20-week psychosocial, psychoeducational support group, but it's specifically for folks who have had suicide attempts and are still wrestling with wanting to die. This group was developed at St. Michael's Hospital, with much evidence behind it that proves its success. It teaches things like emotional and coping skills and how to gauge your own behavior on a sliding scale so that you know when you're escalating and how to reach out for help. We are fortunate that this now runs in Waterloo Region, but when I talked to the Suicide Prevention Community Council of Hamilton last week, they hadn't heard about this great program. They're hungry to have such practical training in their region as well. It's another proven practice that can be rolled out across Canada. Mr. Speaker, there are a number of experts who contributed to this discussion of Bill C-300 and the federal framework for suicide prevention at the committee level. We thank them for their time and expertise, and we especially thank them for all the work they do on a daily basis in communities across Canada to help prevent suicides and the anguish and heartbreak that suicide creates. Mr. Speaker, I believe Bill C-300 serves as a useful instrument to promote dialogue, education, and awareness among federal partners. Mr. Speaker, I believe the development of a federal framework on suicide prevention will also carve the way for a greater federal integration of initiatives, programs, and services, and will assist in greater collaboration among partners. And Mr. Speaker, as my colleague from Kitchener-Conestoga mentioned earlier, not only federal partners, but provincial partners, territorial partners, municipal partners, and of course all of the great NGOs that do such great work. It's been a privilege to speak on this bill, Mr. Speaker. Thank you to the honourable member of Kitchener-Conestoga and to all members from both sides who advanced this discussion so that fewer parents next year may suffer a Mother's Day under such excruciating circumstance of loss. Thank you very much.
Resuming debate, the honourable member for Sudbury.